Hi everyone, my name is Lisa Nicholas. I'm the lead instructor for Nursing 342, and today I'm going to be demonstrating non-parenteral med administration via Gtube. Keep in mind that I'm going to be verbalizing each step out loud, and be careful because you may not say all of this stuff in front of your patient. Enjoy. Okay, I'm going to go ahead and grab my MAR first, and I received MAR number 2. Okay, so I have MAR number 2 for patient Steve Rogers. Patient of Dr. Raimundo. Age is, he was born 7/4/1941. He has no known drug allergies. Today I'm going to be giving Cardi 60 milligrams via Gtube once per day. Hold for systolic blood pressure less than 100. What's my systolic blood pressure?
144.
Okay, so I'm going to go ahead and give it. And I'm also going to be giving Pred 10 milligrams via Gtube twice a day. Okay. Type in Rogers, Steve Rogers, and I have Cardi's 120 milligrams, so I know I'm going to be giving half of the dose for my 60 milligrams. And I'm going to be giving Pred 10 milligrams, one of those. Okay, drawer E. This is Cardi 120 milligrams, expires April 2020, and I'm going to be giving half of this for my 60 milligram dose. And Pred in section C. This is a 20 milligram tablet, so again I'm going to cut it in half to get my 10 milligram tablet. Expires June 2025. And those are the 2 meds I need. I'm going to log off. And I'm going to come over here to prepare my medications. I'm going to get some hand sanitizer. Okay. So both of these I'm going to have to cut in half. So I'm going to use my pill cutter here. And I'm going to get a little cup. Okay, let me cut out my Cardi first. I'm going to center it. So I cut it just in half because I'm giving half of the dose. Okay, so I have one half. The other half I'm going to dispose of it in the sharps. Next is my Pred. Save the package, same thing. I'm going to put it here and slice it right down the middle to receive half of my dose. Okay, my half. And this I'm going to dispose of. Okay. Now I'm going to put these in 2 little cups so that I can crush them. Because it's Gtube, I want to crush it as fine as I can. I might have to move it around a little bit. Okay. That's there. I'm going to get my 60 ml piston syringe, and I'm going to go ahead and dilute these 2 medications in approximately 20 mLs of sterile water, or normal saline, or tap water. Okay. And then mix it. Make sure it's diluted and liquefied really well. When I think I'm ready, I'm going to go ahead and draw it up into my syringe. That's going to go in the trash. This I'm going to just expel the air a little bit and put it in my bucket, bring it into my patient's room. Okay, I I have my 2 medications prepared, and I'm going to grab my MAR, and I'm going to go into my patient's room. Knock, knock, knock. Good morning. Hi, my name is Lisa. I'm a nursing student with UNLV, and I'm here to administer your morning meds. How are you doing this morning? Good. Okay, before we begin, can you please verify your name and date of birth for me? Steve Rogers, 7/4/1941. Very good. Mr. Rogers, do you have any allergies? No allergies? Okay. Great. I'm going to go ahead and lay that there and apply some gloves. Okay, Mr. Rogers, I'm going to be administering 2 medications to you through your Gtube this morning. One is Cardi, and it's 60 milligrams, and the other one is Pred, and it's 10 milligrams. So I'm going to go ahead and pull your blankets down just to expose your stomach a little bit so I can get to your Gtube. Okay. And I'm going to grab my other piston syringe that's empty here at the patient's bedside, and I'm going to pull up about 20 mLs of air, because I'm going to check placement before I administer your medications. Okay, I'm going to pinch it here. And I hear a gurgling sound. Very good, so I know it's in good place. I'm going to go ahead and pull back, and there's no residual. I'm going to go ahead and pinch it and close it. Okay. And real quick, I'm going to go ahead and draw up some water here at the bedside to check for patency. And again, approximately 20 mLs of water, just to make sure it's flushing well. Okay. And it's flushing well, no issues. I'm going to clamp the tube a little bit and close it off. Okay, Mr. Rogers, everything looks great here with your Gtube, so now I can go ahead and administer your medications. Again, it's Cardi 60 milligrams and Pred 10 milligrams. Okay, so here I'm just going to verbalize that I'm going to give your medications. I'm not actually going to flush it through the mannequin Gtube. Okay, so that's administered. Then I'm going to go ahead and follow it up with a 20 ml flush. Again, I'm just verbalizing it because we're not actually flushing fluids through the Gtube. Okay. Very good. So all of the medications are in, your flush is in, your Gtube is closed off and clamped. I'm going to go ahead and cover you back up. Cover you up there. Mr. Rogers, that completes our med administration for this morning. Is there anything else I can do for you? Okay, let's make sure that your belongings are within reach. Both of your top side rails are up. Your bed is in the lowest position. And here's the call light. If you need anything, go ahead and push this red button. Can you demonstrate how to use it for me? Thank you very much. And I will see you later. Thank you so much, Mr. Rogers.